Welcome everyone today to our October meeting for the Utah Children's Care Coordination Network. We're excited to have everybody here today. Fall is in the air. Hopefully, it's treating y'all well. Um, all right, so for today's agenda, we're going to start with our announcements, of course, and then we've got some case sharing and brainstorming, our learning session, which is all about teen pregnancy today, and then we'll end with questions and wrap up right around 9:30. So if you haven't had a chance yet, again, we'd love to have you, at the very least, rename your Zoom profile so we know who you are. Sometimes we get phone numbers in here or just names like Sarah, and we're not, or I see initials LL right now. That's a good example of someone. If you can spell out your name in your profile, that really helps us keep attendance for this meeting. Also, if you're new to this meeting, for the first time, we'd love to have you introduce yourself in the chat, including your name, your agency, and your role with that agency. That just helps us know if you're uh, on our listserv. If you're not, we'd love to add you, so we need an email address as well to do that. So for announcements, we do have a couple of learning opportunities conferences coming up in November that I wanted to highlight. So this first one is the Teen to Adult Healthcare Transition Summit. That is happening on Wednesday, November 12th. I'm just realizing the date is not on here. I'll make sure that goes out with the notes, the meeting minutes, but that's on the 12th. There is a link there to register for the conference, and I'll drop that in the chat here once we get going as well, so you'll have those links if you don't have time to grab that QR code just now. This is happening at Primary Children Eccles Outpatient Center, and there's also a virtual option, and I think it's a really nominal fee to register. I think it's $15, so it'd be a great opportunity if you're interested in learning more about teen to adult transition. That will also be our topic for our December meeting as well. And then another opportunity is this early learning mental health conference. That is happening the following week, Tuesday, November 18th at the Mountain America Expo Center. And I will include the link to register for that as well in the chat here in just a minute once we get going. And then again in the notes that go out after the meeting. So if you're not on our listserv, again, we'd love to have you send me your email address so I can get you added, and you'll get those notes after the meeting. Does anyone else have any announcements they want to share?
This is Dora from Shriners.
Hi,
Athena, good
Dora.
to see you in virtual
I
again.
know. I got to see Dora in person at the AAP conference in Denver a few weeks ago, which was unexpected and so delightful to run into somebody I knew in the flesh.
Yeah, that was fun. Um, so Athena, I'll send you the electronic flyer for this, but
Okay.
just to highlight our hand and upper extremities, I mentioned a couple months ago that Dr. Brittany Garcia is one of our hand surgeons, and Angela Wong is their specialist at Shriners. And they're treating brachial plexus palsy at Shriners. So they'll do the ultrasound and also do the ortho and neuromuscular part, and they'll follow through with the child. So we'll see them as young as they're referred. And then just to highlight the other things that they treat are sports injuries, fractures, traumatic injuries, ligament, fractured tendons, and then congenital or birth-related deformities for hands, fingers, or arms. So, um, on CP and other hand and upper extremity trauma. So all of those things. But I will send the flyer, and then on there, on you'll see on the other information is how they also work internally with our prosthetics, orthotics, and rehabilitation services for PT and OT. But just a little highlight, a lot of people think about orthopedics, but they forget that we have hand specialists as well. So that's it. Thanks for your time, Athena. Thanks for letting me share.
Thanks, Dora. Anyone else have any other announcements you want to share? All right, we do have a case share today from Mackenzie Collins, who's with the University Pediatric Clinic. Actually, not seeing Mackenzie on. So maybe we'll zoom ahead for the second and then I'll keep an eye out for her and see if she joins in a second. They said they had a difficult case that they wanted some assistance with, and it was around teen to adult healthcare transition. So this would be a great time to talk about it, but we will circle back to that. So does anyone else have any cases, new resources to share? Updates, ideas, barriers, anybody, this is your time. This is your part of the meeting that you get to pick each other's brain. Feel free to you can either raise your hand, put it in the chat, or just unmute yourself and start talking as well. All right. We got a quiet group today. I've somehow drawn on my screen again. I don't know how I do this every time. Okay, there we go. All right. Well, if nobody has any case shares, then we'll move on to last time. We did a little short skill building session around active listening, and so I wanted to do a quick follow up on that and just see what your experiences were at the end of our skill building session last time. We had a quick challenge to try and do just like 30 seconds of active listening. So I wanted to see if anybody had any experiences with that you would want to share with the group, ways you noticed that it helped in situations.
Hi, Athena. I'll share something. Can you hear
Thanks,
me?
Liz. Mhm.
So after this challenge, I started reading this book on communication by Thich Nhat Hanh, and it's very similar to this in that you actually listen, like without planning response. But even when there's a misconception, you just allow it and listen deeply. And don't correct them. And you can come back at a later time when you're calm to correct the misconception. And I thought that was really beautiful because I've been practicing at home, but I think that works well in the workplace as well. So I just wanted to share that.
Thank you, Liz. Anyone else want to share? Later the same day that we did that skill building session, I was picking up my kiddo from school, and he has a million things to say after school. And like normal, I'm just like, uh-huh, uh-huh, like not really listening very well. And I took the time that day to actually really listen to what he's saying and engage more. And it did make a difference. And I think it also, I think he knows I'm not listening when I'm not listening, which is kind of sometimes why he'll just keep rambling on and on until he can get my attention. But I noticed that if I engage more and stop and he can tell that I'm listening, then he's like comfortable being like, okay, I've said what I said and now I'm gonna go play, kind of a thing. So it works at home, in the workplace, everywhere. I don't have the opportunity to engage as much with people in person in my work life, so it's nice to be able to use those skills at home too.
I love that. And the other thing is, once they become teenagers, they won't be telling you anything. So appreciate it now. You'll get like one word grunts.
Exactly. Yes. Yes. Anyone else have any experiences you want to share about how active listening's helped out in your roles? All right. I do not see that Mackenzie's still joined. My guess is she got caught in clinic. That can definitely happen in the role of a care coordinator. So we'll try to have her share the case she was planning on at a future meeting. But for the moment, we will move on to our learning session. So today is learning session is all about teen pregnancy, and we have Lisa Smith joining us, who's a nurse care manager at South Main Clinic and helps lead the teen mother and child program there as well. And we're super excited to have her and learn all about what she has to share with us today. So I'm going to go ahead and turn the time over to her.
All right, here goes the next test. Make sure I can share screen again. All right, can y'all see it? Is it good? Okay.
Yep.
Good morning. Thank you guys so much for having me. I've already made a bunch of notes. I'm hoping to add to your team, put all my care coordinators in touch with you guys. And I think this is a wonderful group, and I really appreciate being here. And as Athena was saying, I am the nurse manager at the South Bend Clinic with the University of Utah. It has been a while since I've done a presentation on teen pregnancy, so here we go, right? All right. So, oh wait, now these are gonna play ahead. All of my little videos are hilariously old from 2002, but they're funny. So I feel like I just have to keep sharing them. And I don't know, oh, wait, come on. Let's see. So getting inside that teen brain where their brain has left their body. Liz was commenting on, the teenager that doesn't talk to you. Yeah, that that happens. Totally. Um, let's see. Okay. I won't share this one because this one has sound, but it's this program that Frontline did back in 2002 about the teen brain, and they were interviewing like a couple of teenagers about like, you know, what lessons do you have for parents out there, for adults, yeah, in your life, and their comment of, yeah, I think they've just forgotten what it's like to be a teenager. And they're probably right. I think, a lot of us as we grow up, forget what it might have been like for us as a teenager. So I just invite you to try and reach back to that, or thinking about the teens that you may work with. So a general overview of teen pregnancy. I love this little cartoon because does that not explain so many of our teens and their relationships these days? Incidents, risk factors, teen pregnancy still prevalent in the community, limited education, healthcare access, lots of risk factors that impact all of the rates and everything. Health, socioeconomic consequences. Teen pregnancy definitely leads to health challenges for mom and the kiddo, socioeconomic hardships for those young families, prevention strategies. There, we need lots of community based interventions, support systems for teens and the pregnant teens, that just to support them continue to reduce the incidence and the rates that we have currently. And on that note, here are the rates that we have had since 2009. Yay, they've gone down quite a bit. I love showing similar slides to our students, and we talk about, like, we've done a really good job as a community, as a nation, and reducing these rates. Let me see, so the greenish ones are Utah. So we're lower than the US, which is great. And I think, we need to continue doing what we're doing. If anybody is really interested in like looking at the data, the the IBIS system for state data is wonderful. You can totally geek out and grab lots of different data and graphs and manipulate things to get great information. Let's see. So the big question always is, why is it declining? We don't know 100% why it's declining. Overall, the general birth rate amongst all ages in the US has gone down in general. Some I've heard anecdotally people talk about, well, it's just, expensive to have a kid. And so families are choosing to wait longer, or maybe not having as many kids in general. So certainly that could be impacting teen birth rates as well. Definitely over the last couple decades, access to long-acting reversible contraception has greatly improved for our adolescent population. Comprehensive sex ed, healthy relationship education, which is greatly needed, I think, especially amongst high-risk youth. And there are programs, I'll kind of talk about those later, that are presenting this information to our high-risk youth in Utah. And when we look at when that funding and those programs were implemented, you can definitely see a correlating decline or greater decline in those teen birth rates. So where I don't think it's been studied very, very well and, great concrete data, there's definitely potential of having that education available to teens, and in our young people in correlation to making healthier sexual activity decisions. So what I mentioned earlier, the health consequences that, teens have, higher health issues. Just in general, pregnant teens, they have a higher risk of preeclampsia, anemia, prolonged labor, which has its own risks inherent, substance abuse risks. A lot of, if teens we see maybe are getting, they've already dropped out of school or kind of dropped out of some of the typical adolescent social structures, and putting them at higher risk of substance use concerns, which of course, again, have impacts on pregnancy outcomes. Mental, emotional health, in general, in the US, we're having issues with that. And then, add the stress of being a pregnant teen and with limited supports, that's going to cause issues down the line as well. I know a long time ago, Dr. Heeman and I would always get asked, how are you, like, how is school attendance and teen pregnancy, like, how are those related? And how do we, keep these girls in school? And anecdotally, we would find, well, by the time they've gotten pregnant, it's not that they're getting pregnant and then dropping out, it's they've dropped out and then they get pregnant. So I think it's not a matter of keeping the pregnant teens in school. It's really educating our teens in general about the potential challenges of teen pregnancy and keeping them in school to begin with, and helping them attain their goals academically. Of course, there's then potential poor outcomes for the child of a teen parent. They have higher risk of low birth weight, premature birth, and all of the things that can go with that. Developmental challenges, of course, with prenatal delivery, respiratory issues, feeding difficulties, growth issues, with all of the physical development challenges, but also those lead to other social delays as well. Prenatal care, a lot of these teens, because they may be scared and not want to seek care, they don't want to tell anybody that they are pregnant, they will delay getting prenatal care. And we know that, early and ongoing prenatal care is so important for just in general, a healthy pregnancy and healthy pregnancy outcomes. And then, young parents, again, depending on what supports that they have out, around them, their cocooning support, so to speak. Some of the risk factors that put them at risk of being pregnant as a teenager, typically they have less support in general anyways. So less support equals, poor outcomes, psychosocial, medical, all of that. Some of those socioeconomic and developmental impacts, economic and poverty issues, when they're trying to balance hopefully finishing their high school education, but a job with limited education, while caring for a young child with probably limited support. It can be hard to get, and maintain a job that can pay the bills. That education disruption, it can be quite an impact, like I said. And then we know that the limited education and not having that high school diploma can really increase all the other challenges of just living life. Health risks, again, the common misconception that teens that are pregnant or parenting are emancipated. They are not, at least not in Utah. They are not. Pregnancy does not equal an emancipated teen. While that teen is indeed the legal guardian of their child, they still have a legal guardian that is dependent on, so in order to get health care, that teen needs a legal guardian to consent to health care. And certain educational things that they need a legal guardian to consent to. And that misconception that, oh, well, they're a teen mom, so then they're emancipated. I think teens lose out on things because people who don't understand aren't there to help them advocate for themselves and making sure that their legal guardian is available and advocating for them, and not just being like, you're pregnant, you're parenting, you're good, move on. And that access to healthcare can be quite a challenge. Dr. Heeman and I think back in 2011, worked with the Utah legislature to push through a law that actually allows these teen parents to consent to their own vaccines. We were seeing this as a big challenge with our teen parents, where they could come in, bring their 6-month-old and get their flu shot, all of their regular recommended vaccines for their child, which is important. But we also know that cocooning this child in having everybody who cares for this baby also fully vaccinated reduces their risk of illness. But these moms who, in general, most of them being disenfranchised from their legal guardian, were not able to consent to their own vaccines. So they couldn't cocoon their own child. And so it was really fun to be able to work with some lobbyists and journalists and share these teen stories of how frustrating it was for them to be able to partially advocate for their child, but not fully advocate for their family, as far as protecting against vaccine preventable diseases. And that did pass. And now teen parents can consent to their own vaccines in an effort to then protect their child and themselves for the future. Again, so the need for support systems. These teens, sometimes, I think any teen in our lives we encounter, they say, oh, I know everything. I don't need that parent. I don't need an adult. I've got it. I know everything. We know that's not true. We know that these young people still need a lot of support. But it sometimes can be really unfortunate, where society will look at these and go, oh, they're a parent, therefore they're more mature. They really don't need as much adult support out there as the other average teenager, which is very not true. They may need more support in trying to just achieve daily goals and everything. So those risk factors, we look at lack of education and contraception education. In schools, there's very limited, in Utah schools, there's very limited access to really good pregnancy prevention. And I think there's a lot of misconceptions about what can and can't be taught in schools. But knowing that in the public schools in Utah, there's not a lot of information that our young people are receiving about healthy relationships and contraception. Is if you have a teen in your life, being willing to point them in the right direction to get that education. If you don't have that information or confidence to give that to your teen, find somebody that you're like, hey, you connect with this person and learn more. There are, and again, I'll give you more information about some programs that are out there that are providing this comprehensive sex education and healthy relationship education to young people in Utah, which I think really helps those young people understand how to make informed sexual decisions. Economic disadvantages, that poverty increases vulnerability and lack of resources, which, with those lack of resources, we know that there's an increase in risky behaviors, including risky sexual behaviors leading to early pregnancy. Foster care, kiddos in foster care, we know have a higher risk of pregnancy because they have the unstable family environments and adult support. Our clinic has worked with DCFS and hope, trying to make sure that the teens that are in the foster care system have access to really good quality education about healthcare, pregnancy prevention, healthy relationships, but really being an advocate for, pushing that our most vulnerable teens have that support and education. And I think there is a lot of hesitancy and embarrassment for some adults, parents talking about sex and birth control with their teens. It can be a really, the teen doesn't want to hear their parents talking about sex. And so, let's avoid it and 100% understand that awkwardness of those weird conversations. But have the conversations, help your families have those conversations. I know my kids unfortunately live in a house where this is dinner talk, and my son definitely rolls his eyes because if he asks a question, I'm giving him an answer, and he many times after he has asked a question, like heard somebody say, he's like, "What's menopause?" And I'm like, "Oh, let's talk about this." And he rolls his eyes. He's like, "Never mind. Don't answer. Don't answer. Don't answer." I was like, "No, you asked the question. You're getting the answer. You are going to be an educated kid so that, when your friends are talking about stuff, you can correct them and point them to good, solid information out there instead of, what teens think is right or what social media is currently showing about sexual behaviors and decision making." When we look at research, racial, ethnic disparities, African American, American Indian, Hispanic, Pacific Islanders, non-white adolescents tend to have a higher rate of pregnancy. Social or systemic inequalities, access to healthcare, education, economic good job opportunities, again, will lead to higher pregnancy rates. Geographic, we have seen that the birth rates are higher in the southern states and rural areas compared to the urban areas. Not sure, I haven't dug into why we see that, but just kind of, knowing that, those of you who are interacting with families in rural areas of Utah, especially, that this may be something that we aren't thinking about, that there's a higher rate of teen pregnancy. Thankfully, I think it may be a good thing is as we are doing more research and looking at these disparities, there are programs that are being built to specifically address these disparities and provide culturally appropriate or regionally appropriate education and support to teens and their families and healthcare providers, so that we are addressing the issue in a way that's specific to the population we're serving. So just a kind of a fun infographic I found about some of the disparities. Lesbian, bisexual teens actually have a pretty high rate of unintended pregnancy compared to heterosexual teens. We look at again, the rural counties compared to metropolitan counties, much higher. Youth in foster care twice as likely to get pregnant by the age of 19. Hispanic, Black, or African American teens 2 to 3 times more likely to give birth than a white or Caucasian teen. Just very, very interesting to kind of look and as you kind of take this in, I encourage you to think about those families that you work with, and do any of them fall into some of these highest risk categories, and then what can we do to help support them and prevent that pregnancy? A while ago, I had an opportunity to talk with some teens and some teen parents and kind of go, hey, tell me what you think. What does it mean to be a teen parent? What is it? And so on here, just some of the things that they mentioned, and this is from teens. This is not, some of these things I'm like, yeah, you're right. But some of them were a little bit surprising to me. That teens would say, no, it's not fun. It's not fun to be a teen parent. It's complicated. There's a lot of compromise involved. It can be scary. Sometimes having a teen pregnancy is a way to keep the partner involved. It's the perception of, well, if I have a baby, then I have somebody who's guaranteed to love me. And if you have kids, that where that newborn stage is great and fun, that newborn doesn't care if they're waking you up every 20 minutes overnight. And sometimes that doesn't feel like love. Teens, what I ask them, what do you believe about parenting? And oh, it's cool, it's easy, I can do it way better than my parents did. And then probably I didn't account for which of these were responses from actual teen parents, but I imagine a teen parent said it was hard. And some no big deal. Finally, I get unconditional love. It's the mom's job to be the parent, not the dad's job, was kind of a message that I heard, which was very interesting, even as teens, some of them were commenting on that. We asked about what are teen parent relationships like? Extreme emotions. I thought that was interesting. Long term, definitely not a research-based response, right? All these teens that are like, oh, I'm going to be with this person for the rest of my life. Maybe, but data will say no. It's not very likely that you will be with the person you are dating in high school for the rest of your life. We all know the people that are, and that's great, but you add a child to the mix, and I think these teens, their relationships struggle there. Asking about what issues, what topics do teen parents deal with? They have to deal with childcare, child support, discipline, being a mom or a dad, and then their parents having to be grandparents. Who has custody? What are the living arrangements? What is my relationship now with the father of the baby versus a boyfriend, a girlfriend, with my family? Having to think about how do I want to parent this child? How am I going to pay to support myself and my child? What about my education? Okay, now we're not together with that, the other parent. And do we co-parent? Do we single parent? How do we do this? Who is legally responsible for this kiddo? How do I access mental health, medical health? How do I pursue and achieve my dreams? And I love this list, because I think if I had made a list all by myself, I think maybe half of these things would have gone on my list for this response. So in a way, it's reassuring to kind of go, okay, they're struggling with things that I thought they would struggle with, but also surprising on sometimes the insight that they have on, yeah, this is actually pretty, an issue that I am dealing with, and recognizing that it is a problem or a challenge. So TMCP, Teen Mother and Child Program. So the program itself was developed back in 1980, and over time it has evolved. Of course, all of our programs have evolved, right? With the, waning of funding and all that good stuff that comes in there. You programs change, and try and fit the needs of the community with the funding available and the time and the people resources available. So at the beginning, Department of Pediatrics and Department of OBGYN came together to provide medical care for these pregnant and parenting teenagers, doing their prenatal care, but also their pediatric care. And remember, they're teenagers. Technically, they still fall under the umbrella of pediatric care. So it was really, a wonderful ability to provide the whole family's medical care under one roof by, just one team of providers in one building. For a while, the program had its own WIC counselor. They had their own social worker, a vocational education counselor, just a very, very robust staff. And over time, we have done a fabulous job as a community in reducing teen pregnancy, that we worked ourselves out of a self-sustaining clinic where we used to have a clinic just, even I've been here 16 years, and I started with just working with these teens for many years. And we had a full prenatal pediatric clinic with a midwife that was seeing patients 4 to 5 half days a week, and a team of 2 to 4 pediatricians every half day for, I think, 6 to 8 half days a week. And we did such a great job that we ran out of enough patients to be able to sustain a clinic and maintain the funding to keep a clinic open on its own. So we did end up folding into the general pediatric and general women's health groups here at the South Main Clinic. And just, I should have added this slide, but I didn't. And just an idea of when I started with Teen Mother and Child Program in 2009, just with our program, not the university at large, the county, just with the Teen Mother and Child Program, we had about 164 deliveries in 2009. And in the data that we kept tracking, in 2014, I believe, we were down to 60 deliveries with just our clinic. So we did a great job of preventing pregnancy in the area. And that's a wonderful thing. And, but sad that we couldn't sustain Teen Mom as it had been originally put together. So now this is kind of what South Main Clinic looks like in general, where we have pediatrics, we have women's health, and we have family medicine in very broad terms. And then Teen Mother and Child Program sits right here in that overlap between women's health and pediatrics. Of course, Dr. Heeman and I are still here, still very involved with these teens, and the midwifery team that sees our teens during pregnancy have been around and seeing these teens for quite a long time, has a passion to really support these teenagers and an understanding of the unique things these teens are experiencing that maybe a 25, 35-year-old expectant mom is experiencing something different. We also have the mental and behavioral health integration within our pediatric clinic, and then having the family medicine clinic with the same support team, what I call our back staff, our nurses and care coordinators and medical assistants support all of the departments. So I think that's a fun, unique thing when you're the teen to adult transitions summit. Um, Love that. And it's been, since we added family medicine here, been a huge goal of ours on how do we really help these, teens eventually access adult medical care. Um, and it's really fun, and teaching our residents, our pediatric residents, that these are still teens that are, they may have a child themselves, but developmentally they're still a teen, and their brain is not fully there yet, and they definitely need some more support, um, and and really teaching these up and coming providers that are learning how they can best support teens and their children in the future. We also, so within our medical homes of South Main Clinic, we have a lot of different, we have the foster care program, we have patient education and support. I love patient education. The unfortunate part of taking over as manager here is my nursing time, my patient interaction time decreases. So hopefully my education and support goes to like other people on the team that are working with face to face more often with these families, and ensuring that they have the knowledge to support the young families out there. We're able to offer financial assistance for medical care. We receive lots of grants to help support that. We do hearing screens here. We have lactation specialists on site, and also being part of the University of Utah, at being able to access the lactation consultant professionals within the university. Early literacy, we give out books to families with the Reach Out and Read program, which I think a lot of pediatric clinics are connected with. Giving out bike helmets, teaching, those safe habits. Basic needs, we get a lot and want a lot of donations to help support the basic needs of these families, especially the teens who are like, I don't know, I have to buy baby clothes now and diapers, and I don't have a high school diploma, so it's really hard for me to get a job that's going to be, I'm going to be able to support that piece of it. So if we as a clinic can help put together little, bags of clothes for, different ages of children, and providing food boxes and connection to those resources, so that these teens maybe have one less thing to stress about, and they can focus on their educational and parenting goals versus how am I going to feed my kid tonight? Like, if we can help overcome some of those stressors, that is great. Services for children with special health care needs, which, a lot of you guys work with these kiddos. Our residents do inpatient rotations, and so we get a lot of very unique, interesting of patients that come in and see the pediatric clinic, and being able to find those supports for them. In general, within our clinic itself, saying we have pediatrics, we have OBGYN, family medicine, we have a medical student-led clinic, we have a dental clinic, we have mental health integration, we have behavioral health integration. And I think as healthcare learns and grows and gathers new information, we're learning more and more about how integrating all of these services into one clinic visit is so helpful for these families who they have enough going on and trying to go from point A to point B 3 times a week, versus, okay, I'm gonna, this teen can come in, the baby can get their 1-year checkup, mom can get her yearly physical and get her birth control renewed. They can go to the WIC office, they can get their therapy, and all in one visit. We also have some wraparound services, including a food bank, collaborative care management, chronic care management. We are physically located within a health department building, so there is a WIC office in the building. Public health nursing programs, great programs out there. If you, as a resource for you guys, know, Nurse Family Partnership, or NFP, is a home visiting program for low income, first time moms, which hopefully that most teens fall into that category. We refer all of them. They get partnered with a nurse that does home visits approximately twice a month, pregnancy all the way until the baby turns 2. So if you know of any pregnant teens that aren't connected to this program, I highly encourage you refer them. Let the teens get some more information about. I always tell them it's like having a professional girlfriend who is going to come over and look at that poopy diaper and go, yeah, that's normal poop. You don't have to worry about that. Let me show you how to be a great mom, and let me show you how to achieve the goals that you have for your life as well as your babies. TCM is targeted case management, where home visiting nurses can go out soon after delivery, again, to support families and accessing resources, and just some general assessments of family and house needs. PAT, or Parents as Teachers, is a great program. Again, kind of how can you be a great parent, and learning that when clients can enroll after pregnancy. I was talking to, and it's nice having them all under in our roof, because I can walk down the hall to their supervisor and be like, hey, I have this really unique patient that I really want to make sure gets connected. But in talking with their supervisors, there's some new programs that have gotten some federal funding recently, or state funding, that will be very similar to the NFP, TCM, and PAT, but will have an easier time enrolling patients. So we're in Nurse Family Partnership. They have to be a first-time parent and low income. There's a program coming that, and if you have to enroll prenatally. So there's a program coming that will allow some of these families to enroll after the baby's born. So some great stuff coming. We have an immunization clinic here. We have a Medicaid eligibility clinic in the building, which is nice to connect some of those resources while they're here for a visit. Going into a little bit more about the community resources, what are we doing? What are we doing to help address the concerns of teen pregnancy, either preventing it or supporting our teens? There's federal funding for sexual risk avoidance education and personal responsibility education program. And this was prep before the other prep was prep. So when I hear prep, this is what I think, because I taught a prep class for a long time. Planned Parenthood has a lot of great resources that are based out of both of these funding sources. Programs out there that are research-based. Choosing the Best. Families Talking Together is a wonderful, wonderful program. If you have the ability to access some funding to do this is a program that teaches parents how to talk to their kids about sex in a educational way, included for the LGBTQ community, and safe sex decision making, Get Real, Making Proud Choices, Teen Outreach Program. These are all programs that were written and geared towards either preventing teen pregnancy or supporting pregnant teens and their partners. So where is the funding? They're mostly the health departments that have the funding. So wherever you're at, these counties specifically are listed as receiving either the PrEP funding or the sexual avoidance education funding. Get a hold of those counties, see what programs they have specifically funded there. I know Salt Lake County, the biggest thing is Planned Parenthood has a ton of this funding to provide education. And I think sometimes we forget that Planned Parenthood isn't just, contraception and, family planning stuff. Planned Parenthood has a huge arm of education surrounding sexual health choices and family planning and healthy relationships. Some of the resources that are out there right now, Baby Your Baby is wonderful. So and Baby Your Baby is available not just for teens, but in early pregnancy sometimes that Medicaid application process can take forever or feel like it takes forever. Baby Your Baby is kind of just that screening program of, based on your answers on the phone or on this application, yeah, you probably will qualify for Medicaid. We're going to give you 45 days of coverage to just get your prenatal care going while the Medicaid application process is underway. Centro de la Familia de Utah, great support for Latinx families. Of course, the family planning programs that are out there, the Pregnancy Resource Center and Planned Parenthood. Midwifery care, I put that in there just because I think sometimes we forget that sometimes a different perspective, or we're just talking to a prenatal provider on, have you worked with pregnant teens before, and how do you support them? I know the birth care healthcare program at the University of Utah, all of those midwives have rotated through at some point with South Main Clinic and worked with a lot of teens. That Nurse Family Partnership Program and the other home visiting programs, refer your families to those. They are huge supports, right? You can never have too much support. High school teen parent programs and support programs. Fortunately, unfortunately, with the drop in teen pregnancy rates, some of the more robust, like standalone school district teen parent programs have gone to the wayside. They just don't have enough students or funding to support that. But most of the school districts have some sort of program or class within the district to add extra supports to teen parents to support their educational goals. Planned Parenthood of Utah has a teen council, which is wonderful. They, teens that'll meet and give them feedback and go, here's what we think would be great as a teen. This is how I want you to educate me. Be smart, be safe, be you. Great education program on contraception and healthy relationships, as well as Get Real as part of that too. And then ease. All three of those are part of that PrEP and sexual avoidance funding, those programs. Children's Service Society has information on parenting advocacy, adoption, childcare. They can refer to all of those different resources in the community. So specifically, how can you help? And I love this slide. If we can say, just don't have sex, and then we're good, we're done. That solves the problem, right? That's not the end all program answer. So I challenge you, talk to the teens and the families. Just, what do you need? How can I support you? How can I give you the education? Parents may not have the best answers from their teens, but if you are another person in that teen's life, just ask, what can I do for you? Encourage these teens. I think sometimes they don't get a lot of encouragement to continue their high school education or ongoing education, but really be their cheerleader. And you can do this. You can do this. What is your goal? All right, how are we going to get there? And just be that cheerleading section for them. Like, you can be a great parent. If this is what you want to do, you can do this. Just making sure they have as much positive reinforcement as possible. Just be there. Sometimes you just sit there and go, when you're ready to ask a question, or when you're ready to have a conversation, when you're ready to access resources, I'm here. I'm not going to push you into it right now. I will encourage you, but I'm here. Just let me know and I'll help guide you in the right place. What we know is effective prevention's access to contraception, especially effective contraception. The IUDs, the Nexplanons, those nice long acting, get it put in, placed, and you're done. You're good for the rest of high school. You don't have to worry about, taking a pill every day, but connecting these teens to contraception. There's some fun laws in Utah that have some wonderful gray areas that some of us have to jump through, but refer these patients, get them into providers that are able to get them contraception. Comprehensive sex ed, being inclusive, culturally sensitive, making sure these teens have correct information about contraception and how it works. Everybody all using condoms. Condoms will work great if you use them correctly. And when I have taught sex ed classes and kind of go, okay, how do you use it? None of them use it right to begin with. So being able to have access to how to utilize contraceptive methods appropriately and correctly, I think will give them a lot better chance of preventing pregnancy. Confidential health services, making sure that teens understand what they can talk to healthcare providers about without a parent being looped in. There's some things that that providers can talk to them about, and that they don't need a parent consent to sit down and talk about prenatal care. Encouraging them have that. Community clinics. There's a lot of different clinics out there that can help relieve some of the financial burden of accessing good quality health care for the pregnant teen or the parenting teen. So making sure that we're willing to connect them with that. And then what can you do personally as a person? Educate yourself. So step one, here, talking to other people about what's being done or could be done. Take advantage of teachable moments. Those, dinner time conversations when the 14-year-old's like, what's menopause? Great. That's an entrance. We can talk about that and, bring it into making healthy choices and understanding human health. Providing growing opportunities, right? Plant those seeds and then water them a little bit. Become that askable adult that, especially I think for the kids that don't live with you, being able to be that safe person for that other teen to come and say, I know I can ask you this question. You're going to give me an honest answer. And you won't tell my mom that I asked a question as long as it's safe, right? Listen, be willing to learn and learn from the teen, while setting boundaries and making sure that you're keeping your relationship with the teens appropriate, and letting them know that I am not the person to call at 3 a.m. But let me make sure somebody who you can call at 3 a.m. Be willing to have brave conversations. And that's where I think that program talking together is, or families talking together. Great. Become confident in having those weird, awkward conversations with teens. Model healthy behaviors, of course, right? Whether teens like it or not, they're learning from everybody around them. Create safe spaces that, where can this teen talk freely and without judgment. And then focus on the positive. It can be easy to be like, great, this person's pregnant. Now here's, like we talked about, these are all of the potential horrible, challenging outcomes that are, now on your plate. Instead of throwing that onto, this situation or conversation, going, I'm so glad you told me you were pregnant. Now I can help you. I am so glad that you went to school today. It's been, 2 weeks since you went to school. I'm so glad you went today. Just finding something. We all blossom when somebody's telling us positive things. And so that's my little blurb. Thank you for listening to me. What questions do you guys have? And I will make sure and send Athena, I will send you all the links to all of these different resources.
Perfect. I was just gonna say I'm so glad you shared so many good resources in there. I feel like I caught a handful that I'll make sure and send out with the notes, like the Nurse Family Partnership Program and other home visiting support, WIC, Parents as Teachers, Personal Responsibility Education Program, Families Talking Together, Baby Your Baby, Centro de la Familia de Utah, and Planned Parenthood. So and there was more in there even. I didn't get all of them, but it sounds like there are a lot of places we can go when people are looking for resources for teen parents. In addition, of course, to the South Main Clinic, if they're able to access that. We wish we had more clinics like yours, integrated approach across the state and not just in that one location. But we're grateful for it existing.
Yeah, thanks for having me. I really appreciate it. And like I said, this community right here seems just an amazing support for the greater Utah community.
Great. Well, thank you. We've been so glad to have you today. Our next meeting will be November 19th. We're going to be talking about supporting sibling support for children and youth with special healthcare needs and as well as healthy relationships for children and youth with special healthcare needs. We also have an update from UDAC about ABA services as well. It's going to be kind of a packed meeting with 3 different presenters, but it's going to be a good one. So make sure to come to it. And then, of course, as always, you can stay in contact with the group through our listserv and our Facebook group. Let's see. Make sure we didn't. I feel like I might have missed a question in the chat there. No, just a comment from Natalie. It's a great presentation. Thank you. So, all right. Thanks everyone for joining us today. And we'll see y'all next month.